Hello, I'm Gloria Bachman. On behalf of CME Outfitters, I'd like to welcome you and thank you for participating in the CMEO BriefCase educational activity entitled Pivoting to Telehealth, Optimizing Technology for the Care of Postmenopausal Women. As I mentioned, I'm Gloria Bachman, Professor of Obstetrics and Gynecology and Medicine, the Associate Dean for Women's Health, the Director of the Women's Health Institute, and the Medical Director for the Proud Gender Center of New Jersey at Rutgers Robert Wood Johnson Medical School, New Brunswick, New Jersey. I'd like to acknowledge my colleague, Dr. Juana Hutchinson-Colas, who collaborated with me to develop the patient case we'll review. Let's review the goals for the program. Our first learning objective is to apply current, evidence-based guidance on benefits and risks of hormone therapy to counseling and treatment decisions for postmenopausal patients. Our second learning objective is to implement best practices for telehealth consultations with postmenopausal patients. Let's begin by meeting our first patient, Clarice Collins, a 52-year-old postmenopausal woman. She's up to date on her mammogram and her PAP, and she's requested a telehealth visit to discuss new symptoms, including sleep disturbance, nocturia, vaginal discomfort and burning, and sexual pain. As clinicians, we're accustomed to seeing patients like this in our offices, but today, I want to focus on how we can best manage patients like this by a telehealth visit. We need to be aware of how our words and subtle actions can make or break the therapeutic relationship with our patients during a telehealth visit. As we watch the first video demonstrating a virtual clinical visit, see if you can spot things the doctor says or does that could be getting in the way of providing optimal care for the patient. Let's talk about what we just saw. This telehealth visit was done the wrong way. The clinician had poor bedside manner or webside manner, appeared distracted, lacked empathy, assumed the patient was heterosexual, that offered behavioral interventions in a shaming manner. There was no additional treatment options other than the behavioral ones, and didn't offer any type of follow-up in between telehealth visits, not even a phone call to the office. So there really are some tips that all of us can use when we are conducting a virtual visit with our patient. And really, I think the most important is engaging with the patient, that the patient is, quote, in our office, despite the fact that they're not physically with us, and we should make sure that we're looking at the patient, break the ice, be empathetic, be an active listener, avoid unnecessary movements and multitasking, and close the visit in a way that the patient knows your office, you are open to further follow-up, and if there are any issues or concerns before the next telehealth visit or inpatient visit, that you are available. Many women don't realize the symptoms of menopause that erode their quality of life are treatable. So that's why it's so important that during the telehealth visit that you let the patient know that there are interventions that will assist in getting rid of the problems, either the vaginal problems, the hot flushes, the sleep disturbances that she's experiencing. Let's return to that initial consult with our patient, Ms. Collins. In this next video, see if you can spot ways that the doctor implements some best practices for telehealth. We just heard from Ms. Collins that telehealth can be an effective platform for managing symptoms of menopause, and they can be comparable to those with traditional healthcare delivery systems and methods, as we just saw. That it does improve patient engagement and satisfaction. Ms. Collins was very happy with the encounter. You can do full consultation on how to manage menopausal symptoms, and it allows clinicians with traditional office-based practices to to maintain continuity of care for their patients. Many of the other benefits of telehealth visits are that it eliminates the travel time, the costs, the long waits in waiting rooms. It reduces time that women have to take from work or caregiving responsibilities, and it's a cost savings for both patients and the healthcare systems. Clearly, telehealth is a cost-effective way of caring for patients. Data have shown that telehealth visits save $19 to $121 per visit by diverting patients from more expensive care settings, and almost 3/4 of patients have their health concerns addressed during a telemedicine visit. And actually, 16% of patients would have done nothing if they had not done a telehealth visit. Even though telehealth is an exceptionally great way of seeing our patients, especially during pandemics, there are some barriers to telehealth, especially for postmenopausal women. And these include the lack of internet and phone access that some patients may have, the lack of technological knowledge or training in how to access a telehealth platform. There may be doubts about cybersecurity, and obviously, in homes where there is no privacy, the woman may not want to discuss her symptoms with other family members or friends around. It's clear that there are many sources of data, including the Cleveland Clinic and the Department of Veterans Affairs, that show that telehealth is a successful platform for caring for patients, and that patients embrace this form of clinician-patient relationship, especially when an in-office or physical visit or lab testing is not necessary. So let's think back to the video we saw demonstrating an effective way to conduct a telehealth visit. What did the clinician do? Well, there was good bedside manner, there was empathetic communication, education on both pharmacologic and non-pharmacologic interventions, and a follow-up plan in 6 weeks, so that if there are other aspects of the hormonal therapy that had to be adjusted or addressed, the patient would be doing it at that point. So let's talk briefly about the vasomotor symptoms of menopause, which basically is a common presenting symptom that women come to a clinician for help or assistance with. From the data, we know that menopausal symptoms can last for up to 7.4 years, and they are associated with many of the symptoms that we saw Ms. Collins complain of: sleep quality, sexual symptoms, as well as difficulty concentrating, reduced quality of life. And menopause is also associated with health problems, cardiovascular, bone, and cognitive risks. So that hormone therapy remains the gold standard first-line therapy for relief of vasomotor symptoms in appropriate candidates. Genitourinary syndrome is another common complaint that menopausal women want assistance with. This type of atrophy that occurs in the vagina actually worsens over time, so that as women enter into their postmenopausal years in their 6th, 7th, 8th, 9th decades, that they may actually note that the condition gets more severe for them, so that they're more symptomatic. And again, estrogen is the most effective treatment for genitourinary syndrome of menopause, because it does improve the genitourinary tract anatomy. It increases superficial epithelial vaginal cells. It decreases vaginal pH. And most importantly for the woman, it improves her symptoms. Low-dose vaginal estrogen preparations are effective and generally safe, with minimal systemic absorption. So what are some of the approaches that we can use in assessing genitourinary syndrome of menopause? I believe the first is starting the conversation. That many women are reluctant to bring up this topic, so we as clinicians can start with something as simple as many women after menopause have concerns about sexual function. What about you? Tell me about it. And also asking direct screening questions. Do you have problems and concerns related to sex or pain with sexual activities, bleeding after sex, or problems with urinary leakage during sex? And the other key point is don't assume the patient is heterosexual or partnered. Now let's return to our patient case, Ms. Collins. In this first video of a follow-up visit, see if you can spot things the doctor says or does that could be getting in the way of providing optimal care for this patient. Now let's look at a better way to conduct that follow-up visit. Now many clinicians ask, who is a candidate for hormonal therapy? Unless there's contraindications, estrogen therapy is indicated for treatment of bothersome vasomotor symptoms, treatment of genitourinary syndrome of menopause, prevention of bone loss, and women with hypoestrogenism caused by any of these problems in this slide, including hypogonadism, primary ovarian failure, bilateral oophorectomy, or premature surgical menopause. Contraindications include unexplained vaginal bleeding, severe active liver disease, prior estrogen sensitive breast or endometrial cancer, coronary heart disease, stroke, or personal history or inherited high risk of thromboembolic disease and dementia. Bottom line, hormonal therapy is the most effective treatment for both vasomotor symptoms and genitourinary syndrome of menopause. When prescribing hormonal therapy, in the woman who has a uterus, endometrial protection should be addressed, and progestin therapy should be added to systemic estrogen therapy. Progestin therapy is not recommended with low-dose vaginal estrogen, but appropriate evaluation of the endometrium should be performed if vaginal bleeding occurs. It's important to discuss the potential risks of hormonal therapy with all postmenopausal women and try to direct these risks to that individual woman's medical history. It's also important to individualize the risks versus the benefits for each of our patients, taking into account their age, their health history, and other factors that you may want to consider when deciding whether this is an appropriate patient or inappropriate patient for hormonal therapy. When weighing the risks and benefits of hormone therapy, Level 1 recommendations note that the benefits are more likely to outweigh the risks for symptomatic women who initiate therapy when aged younger than 60 years or within 10 years of menopause onset. But it's important to also remember that when discussing the risks and the benefits, it truly is shared decision making, which means that you and the patient come to the conclusion as to what is best for the patient and what fits her needs with the symptoms that she's describing. Now let's return to our patient case, Ms. Collins. You recall that her second telehealth visit, she was started on hormonal therapy. Now let's look at her at the next telehealth visit. So the outcome of Ms. Collins' third telehealth visit is that she explained that despite using hormonal therapy systemically, she was having genitourinary syndrome of menopause symptoms, and therefore topical estrogen concerns and dryness were addressed. So here's the crux of telehealth visits. When is an in-person visit necessary for the postmenopausal woman who has symptoms of menopause? And these are really key. The woman with postmenopausal bleeding, the woman with prolapse and needing a pessary fitting, the cervical cytology or mammograms are not up to date, that she needs laboratory testing, or there are specific needs for a physical exam, imaging, or other evaluations. There are many clinician resources that all of us can use for telehealth and also for guidelines on the use of hormonal therapy in postmenopausal women. You can find all these links in the resources section for this activity, and these slides are available for download as well. So what are the key take-home points regarding telehealth visits? Bottom line, it's an excellent way to assist symptomatic postmenopausal women who do not require an office visit. So let's wrap up by reviewing SMART goals that you can carry into your practice. That is, when providing telehealth consultations for your postmenopausal patient, confirm the mammogram and pap testing are up to date. Ask patients about the menopausal symptoms they're having. Provide education, empathy, and empowerment. Counsel patients on the risks and benefits of treatment options. Engage in shared decision-making, and have electronic resources ready to provide to all patients. To receive CME CE credit for today's program, click on the Evaluations tab to complete the post-test and print your certificate. Thank you again for participating, and thank you for providing the best care for postmenopausal patients.